Welcome back to my YouTube channel, Health Matters with Dr. Shritama Banerjee. Today I'm back again with another new video, this time about antibiotics. So, what are antibiotics? Antibiotics are antibacterial medications. That is, antibiotics act against bacteria. They treat bacterial infections. This is my first point, which I want to make very clear. Antibiotics are meant to treat and they treat only bacterial infections, not viral infections, not parasitic infections, not helminthic infections. So, uh, my next point, common cold, which most of us suffer during the winter season or during the season change times. Common cold is caused by viruses. Common cold is not caused by bacteria. So, coming to my conclusion, antibiotics do not work against viruses. Common cold is caused by viruses, not bacteria. So, antibiotics are not required and are not effective in the treatment of common cold. So, the misuse of antibiotics is being done, and antibiotics are being prescribed for the treatment of common cold. These are not indicated. In case of common cold, the majority of the patients get cured only on taking adequate rest for 7 to 10 days. Antibiotics are not indicated, and antibiotics do not work against common cold. So, what do we need to do if we have a common cold? First of all, the symptoms of common cold are running nose, cough, low grade fever, um, sore throat, sneezing, fatigue, mild headache. These are the symptoms of common cold. So, for common cold, adequate rest for 7 to 10 days, along with taking a lot of warm liquids, warm fluids, staying adequately hydrated, taking adequate rest. And if you have allergic symptoms, that is, if you have running nose, sneezing, then you can take the help of OTC, that is over the counter antihistaminics. And if you have a low grade fever, if you feel like it, you can take antipyretics. Uh, but antibiotics are not indicated, antibiotics should not be taken. So, when do you need to take antibiotics in case of when you have a cold? You need to take antibiotics only if the fever or the symptoms do not get better, or rather, if they get worse after a span of 10 to 14 days. Um so, in that case, if the symptoms get worse, that is, if the low grade fever increases to high grade fever or continuous fever above 102 degree Fahrenheit, or if you have swollen lymph nodes, if the cervical neck lymph nodes are swollen, if they are painful, if the sore throat, the throat irritation increases, if you have pain while swallowing, if the fever, the temperature increases, and if you have a cough with expectoration, mucus of the color of yellow or green, or if you have ear ache, or if you have facial pain in the sinus region, or if you have chest pain while breathing, or while coughing, uh, and if these symptoms persist or get worse even after a span of 10 to 14 days, then you have to visit a doctor, and antibiotics are generally required. Why? Because these worsening of symptoms are not due to viruses. They are after the viral infection has caused the common cold. These persistence or worsening of symptoms is due to a secondary bacterial infection on top of the primary viral infection. So, common cold is a viral infection for which antibiotics should not be given. However, if these clinical features of common cold worsen even after a period of 10 to 14 days, or if they persist or if they worsen after a period of 10 to 14 days, then you have to take a course of antibiotics which has to be prescribed by your physician. So why am I stressing on the point that you should not use antibiotics indiscriminately, and you should never prescribe antibiotics unless when absolutely required? I'm saying this because antibiotics have been prescribed so very frequently and so indiscriminately that this has led to a condition of antibiotic resistance, and this is a very serious condition. And let me tell you, this is the third highest cause of global mortality all across the world after cardiovascular diseases and respiratory diseases. So this is a very serious condition, antibiotic resistance. That is, all the first line antibiotics are gradually getting resistance. What is the meaning of antibiotic resistance? It means that the condition or the disease which a particular antibiotic was supposed to treat, this particular antibiotic is not being able to treat this condition effectively. Why? Because the causative organism, the bacteria which was causing this particular disease, has mutated itself so that the antibiotic is not being able to work against it effectively. And why are these mutations, or why are these changes occurring? This is because indiscriminate use of antibiotics is being done. So this has to be stopped. And this highlights many things. This highlights that antibiotics are antibacterials. This is the take home message number one. Antibiotics act only against bacterial infection. Number two, and common cold is caused by only viruses. And only in certain conditions, when the common cold persists or gets worse, then antibiotics are indicated. And why is this entire knowledge very necessary? This is necessary to prevent antibiotic resistance. So, this brings me to the end of this video, and hope you liked it. And I shall be back again with another educational video. Till that time, stay happy, stay healthy. Bye bye.